Hey everybody, welcome back. Prometheus here again. So I've been getting a lot of comments and questions, I always do, about medical gear, what to use, what not to use, what works, what doesn't, especially here in light of the recent events. I've been flooded with messages in my inbox on Facebook. So I want to get this video out here to you guys and go over some of the basic different stuff and just let you kind of know what your options are and what you may want to look into. The first thing when you're picking a medical kit is to try and determine what do you want it for? Do you want like a blowout kit, something that's just going to stop the bleeding and that's about it? Are you looking for something a little more? For me, an IFAK, an individual first aid kit, is your blowout kit combined with other items, miscellaneous items that you may need throughout your adventures as you travel around, as it may be. So you've got that, and then if you're going camping, if you're going to be out in a more austere environment, what else do you need? What are some other considerations you may have? So we're going to run through those here real quick, and the first one we're going to start with will be the blowout kit. So your blowout kit, for me, is a small little pouch. I picked up like a dozen of these. Clearance or Blackwater pouches, clearance. They were dirt cheap, and like I said, I picked up about a dozen. I gave a few to some of my friends in law enforcement and some of my other buddies just to keep around and keep it have on them. So this pouch itself, you get trauma shears sticking out the top, and an Israeli emergency bandage through the molly loops in the back. Inside, when you open it up, normally all this stuff would be webbed in, but I've got them out here for display purposes. You've got a tourniquet. And then some miscellaneous trauma pads, some tape, ace bandages, bulky gauze, and of course some gloves. I have one of these right around each of my vehicles. You watch some of my other videos, you'll see them laying around in the periphery and outskirts. This is a very basic kit for me. It's something that's easy, inexpensive to make, put together, half dozen of them, give some away to friends, and keep some around all over. I've got one in the garage, like I said, in both vehicles. I keep one, I keep some other stuff down by with my reloading stuff, and when I do shop down in the basement, working on different firearms or accessories, just to have around. So that kind of covers that aspect. These bounce around in the car. It's all different environments. It's one of the reasons why you won't see hemostatic agents in here like Quick Clot, Combat Gloss, things like that. Next we've got the what I consider my IFAK, and I've got mine here on battle belt here. Composed of two things. I've got another tourniquet on here. It's actually in a magazine pouch. Half is in the double stack mag pouch, the other half is hanging out, and then rubber banded on, so it'll come right out. You rubber band something on, always remember you don't have to worry about taking that rubber band off. Just rip it, it'll pop, it'll come right off. This is on here, this is on a molly backing that's attached to the belt, and then it's got a Velcro pad. So you click it, release it, tear it off, sorry about the Velcro sound there, and then you've got your IFAK in your hand. It's got a handy carrying handle on it. One of the things, if you're putting these on yourself, consider where they are and how you will get to them. For example, the tourniquet here is right here, center midline. I can reach it with either hand very easily, and it's quick to get to. This rides basically in mid-center of my back. I can reach it and unbuckle it and rip it off with either hand, which is important because you don't know what, if your other hand is injured, what you may or may not be getting into. So keep that in mind as you're placing these things. When I wear a chest rig, I'll normally have chest rig is where things get difficult for me. I'll have my tourniquet right in the center midline, and then you kind of have to pick a side as far as where you're going to put your kit. For me, I'll use a blowout style kit, which is a little smaller, more compact, more easier to fit on the sides, or kind of off to the side, offset, where as far as this one's just a little bulkier. So let's take a look inside here. So unzipping it and going into it, and I haven't undone any of this, simply because well, there's no need to. The one item that's loose in here is the emergency bandage. The rest of this I've got more trauma pads. I've got some non-adherent dressings, some 2x2s as opposed to 4x4s. They just fit in these easier. I have 4x4s, some of my bigger bags. Some burn gel that's in here. Burn gel is pretty neat. If you, it does a great job of stopping a burn, basically dead in its tracks. You get a burn, you put it on there. It's going to basically interrupt the process and cool it down very quickly and rapidly. Also helps to soothe the pain. It's really cool stuff. If you've ever gotten a really severe burn and had to put on there, you would really be pleased. It's by Waterjet. They're kind of cool. It's nice to have. You can buy you know, like 2 dozen of them in a box, fairly inexpensively. I keep a couple in the kitchen, a couple of my different kits, just to have around just in case, especially if I'm not camping. So anyway, we've got trauma shears and a small light in here, both corded in with some 550 cord, a bulky gauze dressing, some various gloves. And this is where my my individual first aid kit comes into effect. Most of this other stuff is for blowout purposes. It's a little mesh pouch. We have different items you may run through throughout your day that you may need. I've got a little micro barrier shield for CPR. It's something as simple as chapstick. We're at a Second Amendment shoot and out there all day, and I was prepared for good weather, but the wind was out there. It was nice to actually have some chapstick on me and be able to use something out of my kit rather than just lug it around all the time. I also keep a few different medications. This is basically all just simple over-the-counter stuff. Ibuprofen, acetaminophen. I've got some aspirin in there as well as some diphenhydramine, which is Benadryl. And it's basically, you know, just in case allergies, anything else start acting up. Worst case scenario, if somebody was experiencing an allergic reaction, you are able to get a couple of crushed up tablets into them. That's better, you know, it could be better than nothing if you don't have an EpiPen or things like that. Maybe the amount of time you might need to buy them to get to some a higher level of care. Of course, keep in mind as you're watching this video, this is all for entertainment purposes. None of this is meant to replace the advice or knowledge of your physician or other qualified medical trainer personnel. Miscellaneous other items I've got in here, obviously some alcohol prep, some Band-Aids, a few small tegaderms, triple antibiotic ointment. I've even got a small pair of hearing protection in here. Normally you guys always see me wearing muffs, but just in case, if I've taken to bring this belt all around, or at least this kit for sure with me. So at least nice to have something extra and on hand. So we've got that as well. A lot of these kits you'll see, you know, they sell them, they come with red tabs or Velcro, and I've got like a green patch on that one. You know, it can be whatever they can be whatever you want. So, you know, don't let that stand in your way as the deciding factor. There's a lot of things that are pull double duty if you're under crunch dollar-wise. So some of my other kits, I have fun messing around with different things. I've got a couple of those pouches. I told you I had a bunch. I've still got a couple of those pouches. I put 2 of them on a drop leg panel. I really don't like drop legs, but I had this panel, and it's actually kind of nice to just have around. It's both an IFAK and a blowout kit combined. Again, we've got cordage for various light and some other and the trauma shears. It's nice to have around. You can throw it down at the end of the range if you're down, especially doing some training or something, and it's just laying there in that way. If you don't have it on, you're just doing, you know, practicing, let's say, presenting from your concealed carry and doing reactionary drills in that fashion. You don't have an entire belt on you. Just different ways of handling the same thing. I've also got, when I go camping, I bring a larger bag, such as this. This is, folks may recognize, this is an M3 bag. These were big in Vietnam, and basically the medics would carry these. It's actually surprising the volume of supplies that you can fit in here. So basically, this is something that would be a little that you would bring when your higher level of care is further away, and definitive care could be hours or even days away if you packed yourself pretty far out. You may even have to self-rescue. So some different things in here. A couple small self-folding splints, some other things, other bandages. some other items that may come in handy. Not your pads, obviously some more Israeli emergency bandages, things along those lines. You know, and then of course, you know, this is a bag that you know, base style jump bag, similar to what I used to run calls with back in the day. One of the most important things you can do is get your mind in the right spot. Getting your mind in the right spot, getting the training and knowledge, you know, even if it's just a basic level, depending on how far out you want to go and you want to take it. You know, none of this stuff that you see out here, nothing that you're going to buy can replace what you can learn. You know, it's amazing someone with the right skill set, with you know, with a simple belt, roll of paper towels, and some duct tape could you know, could take care of a lot of different things just with something that simple. So don't necessarily always get hung up on the gear. It's nice to have mission purpose items and keep yourself on track in that regard. But keep in mind that if you don't know how to use these, if the first time you're ever in a situation where you do need to use it is the first time you've ever opened your blowout kit, the first time you've ever handled or seen these things, you're going to seem foreign to you, and you're going to waste valuable time when you could be, you know, possibly helping save a life, as opposed to watching it expire while you figure out what you're doing for the first time. If I was going to recommend a book, I like The Field Guide to Wilderness Medicine by Paul Auerbach. A lot of this stuff is going to be above the skill level of the general person just getting into it, even first responder or EMTB. Some of this stuff gets pretty in depth, but it's nice to have general outlines, guides, and these are relatively inexpensive. This is a second edition. I think second edition now on Amazon can't be more than $10, I would think. So let's talk a little bit about a couple of the items that we have out here. If you're going to look into building one of your own kits as opposed to buying one, and hopefully if you do that, you buy, you know, several of each component. You can make a couple duplicate kits. That way you always have one with you, preferably one in each vehicle, one with your range bag, and then, you know, something that would go on whatever you use, be it a war belt, chest rig, you know, whatever it is that you use. We've got two different tourniquets out here. This one is the soft, and this one is the CAT, combat application tourniquet. The CAT's probably one of my favorites. It's easy to deploy it's one of the easier ones to deploy one-handed. The windlass is more self-locking, clicks kind of right into itself. You strap it over, lock, you put it into place. This has a lot of neat features as far as locking it down and things like that, but it's really better to use on someone else than on yourself. And it's bigger, it's heavier. This one folds up nicely. You can tell here, I think I already mentioned I've got it in a double magazine pouch right there, double stack mag pouch. And it works out fairly well. They also make the smaller almost rubber band IV tourniquet style type out there on the market. Corey with Range Time has one on his rifle sling, and it's a small pouch, fits up it's really compact, really cool. And for him in his application there as an instructor, having his rifle on him, it's right there with him. If something happens with, you know, dealing with students, really good call to have something like that there. For me, for my purposes, I would rather go with something like a CAT. Nothing against those. Some of them are fairly economical. They're relatively straightforward to use. But that's overall, that's just kind of where I'm at right now. Everybody has their preferences. The Israeli emergency bandage, I mentioned it several times before. There's several different types of emergency bandages. There's a lot of good ones out there. Or a few different good ones out there, I should say. The Israeli right now is economical. The 4-inch one's pretty small. They're fairly durable, and they've got a good track record and history behind them. Bulky gauze is really some good stuff. Trauma pads. You know, you can't have too many of those. People ask me what, you know, if you're going to make a blowout kit and you really only were going to have about 5 items in it, small, you know, what would those 5 items be? The top of the list would be your training, your mindset, just having your head in the right place. And then no particular order, the next 4 would be tourniquet, Israeli emergency dressing, trauma pad, and some ace wrap, with bulky gauze coming right up there in the mix. Those items are pretty much going to get through, at least as far as a blowout sense, wherever you're going to go to. One thing that I've conspicuously left out, I wanted to leave here toward the end, is different hemostatic agents that are available on the market today. There's several different types. I would say anything powdered I would stay away from. They make smaller sport ones now, unless you've got some sort of clotting deficiency. You take Coumadin, something like that. The smaller ones are going to be next to useless for anything that you'd be using in this sort of application. They have the larger packets, more traditional ones that you're used to. The powdered I shy away from for the main reason you're going to have to put something on it in addition to that. The powder alone isn't going to do it. You need direct pressure. If you've got the appropriate training and skill level, and packing a wound if need be. Not to mention, some of the other things that go along with that. If I was going to pick one hemostatic agent device to go with, it would probably be the combat gauze. There's a couple of different variants out there, but you've got your impregnated gauze, and you're going to use it to apply some direct pressure on anywhere. You're going to want to follow up with a trauma pad or something on top of that. In my normal kits, especially my blowout kits, I don't have any sort of hemostatic agent along that lines with it, simply because they're bouncing around, they're going in and out of vehicles. In the winter it can be -20, summer it can be 105 degrees. That's going to play havoc on the shelf lives of any product. And not to mention it becomes cost prohibitive. I mean, I can put together, for $20 or so, I can put together, each, building a couple, maybe even less. Maybe I can get that price down to $15, especially if I get some pouches on clearance. And I can afford to put one in each vehicle around the house, and I can have half a dozen of these things. When you're talking about building an IFAK kit, your price is going to go up more, especially when you start throwing the tourniquets into the mix, which is going to be one of your more pricier items that's going to go into it. And if you start dropping a higher priced anticoagulant, a coagulant on their hemostatic agent, your price is just going to go up from there. It just becomes cost prohibitive to put those in all your devices. Really, when it comes to these things, between direct pressure and a tourniquet, if that's not going to solve your problem, a clotting agent probably isn't going to do too much to help that either. Especially in the sense we're generally talking about here. Now, if you're in a more austere environment, definitely some combat gauze I would always pack out with me. If you're talking about being on the range where 5 minutes, 15, 20 minutes, you're going to have qualified medical care on site. An ambulance will be coming to you. You're going to be able to get to definitive care after that relatively short period of time. Those things start changing up. So it's something to keep in mind. Some miscellaneous thoughts here as I wrap up. There's some other stuff out here. With that mindset, triangular bandage. I mean, with your ace bandages, bandana, schmog, whatever you've already going to have with you, why take up the space to have a triangular bandage? I mean, if you want to have one, fine. But why? They're inexpensive anyway. It's not a cost prohibitive item. It just takes up valuable room. You could put something else in there. I mean, if you look at this compared to the size of a 4-inch Israeli dressing, that's almost half right there. I'd much rather find a way to have an extra one of these than a triangular bandage. And depending on what I've got here, I have extra Israeli bandages laying around. Some other things to consider: chest bandages. If you got a sucking chest wound, do you really need? I mean, like the Olaf's bandage is kind of cool, but do you really need that? And where are you going to fit it in your blowout kit, for example, or even an IFAK? How often are you going to get a second chest wound? And if you do, you can treat it with something else. Let's say you have a sheet of petroleum gauze in there. You've got your tape. By the way, I prefer a silk tape when dealing out in the field. It seems to do a little better with wet and clammy skin, things like that. It tends to stick better than some of the other tapes out there. Just keep that in mind. It's not the end-all be-all, but I just overall I find silk tape to be more useful in a variety of applications. So anyway, you tape down 3 sides and create your own one-way valve, so to speak. And you do the same thing if you had to with some trauma pads and tape, and use a Tegaderm for 3 sides. If you've got one of those, you can take the wrapper from this. You've got plastic right here. There's your one-way valve taped down 3 sides. It'll self-seal as you breathe in and out. There's a lot of different things. Zip ties. Take a couple zip ties and throw them in whatever you've got. If you've got to go old school and pull a Boy Scout routine because you're out in the middle of nowhere and you've got to splint something with some twigs and sticks between the cordage, and if you notice on that other bag I got paracord, I've got paracord everywhere, jammed in all little holes and stuff like that. You know, these things can be invaluable and could be a lifesaver. You know, if you've got any questions about anything you've seen here today, feel free to ask those over on my Facebook page. You can go to facebook.com/gunreviews. I appreciate all the likes and subscriptions. You know, as we get the you know, my channel here re-put together after it got wiped. If you need any help with any of this stuff, visit me there. Going forward, if you want to see some more individual reviews of blowout kit, IFAK, anything like that, let me know, and if the interest is there, I'd be more than happy to make a video on each of those, a little shorter and condensed and mission specific, if you will. So thanks again, and we'll talk to everybody later.